surgery. Surgery itself, there's a wide range of procedures that can be performed, from minimally invasive procedures all the way to very large complex procedures.
Now, some of these non-surgical, or what you might consider to be non-invasive approach to treatment, what are some of these physical therapies? Is there manipulative therapy? Is there just physical therapy? Or what? There's so many options that you hear. What are really legitimate options?
So, bottom line is non-surgical or conservative management really should be the first choice. There are very few indications for emergent surgery where you bypass those other options. In terms of medication, we'll start with that. Something as simple as over-the-counter ibuprofen. Again, you should always check with your doctors to make sure that it's appropriate for you to use. Something like that can help with an inflammatory type process. And then taking you through physical therapy, which you had mentioned, can help for a number of reasons. Oftentimes, spinal disorders, the extent of the problem is related to a number of issues, one being muscle strength, also flexibility. So there's no specific conservative therapy regimen that has been found to be better than others. And in certain instances, things like manipulative therapy may be appropriate. But general strengthening, flexibility, and actually education on postural mechanics and body mechanics for lifting are the most appropriate types of non-surgical interventions.
So we should use our muscles as a splint, is that right, in some cases?
Correct. That's a good way to look at it.
Build them up to strengthen ourselves. Now, when we find that these conservative measures have failed, and I know we can't do every procedure, but can you tell us a little bit about some of the minimally invasive procedures that are available? For example, somebody has a herniated disc. I think we'll use that as an example. How do you approach that?
So we'll talk a little bit about, because we talk about minimally invasive, and that's a new term within the spine surgery, relatively new term within the spine surgery world. But even before that, there are procedures such as epidural injections, which can deal with some of these problems. For instance, if you have irritation on a nerve root, so we'll use the spine model again. As the nerve roots come out between each of those vertebral bodies, those can get irritated or compressed. And using X-ray and medication, you can actually inject in and around those areas to help decrease the inflammation, irritation, and that helps take care of pain. Now, there's criteria depending on how severe the process is in the spine that will determine the effectiveness of those sorts of interventions. When you go to spine surgery itself, minimally invasive procedures involve the definition of making a very small incision, trying to avoid too much dissection or cutting through musculature to get to the area that you need to, and then whether it's through a microscope or sometimes we use small tubes that we look through with a microscope, opening up the areas that are either irritated or compressed in order to give relief of the problem.
So you can go in, for example, with an instrument and take a look at the bulging disc.
Correct.
Right? And you can do something to that disc. What can you do to that disc?
So that's a perfect example. Probably the most common minimally invasive procedure that we do. Again, using a very small incision, we can create perhaps an inch or so, a small pathway down to the area between the vertebrae. This is now the back side, and you can actually go in between the vertebrae through, again, a 1-inch incision. Sometimes we use a small tube to get there, and you can basically through the spaces between the vertebrae, get to the disc space. So if you have a disc bulge or a disc herniation that's pressing on a nerve root, you can get right down to that disc. In the case with disc herniations, you don't take out the whole disc. We talked about the disc that you have in between each body. You don't take out the disc. This shows it very well that this is a disc herniation, this red portion, and you just take out the portion that's actually pressing on the nerve. So you don't take out the whole disc in the instance of a disc herniation.
Is that surgically excised, or is it destroyed some way, or how do you do?
Surgically excised.
Surgically excised. Okay. All right. So this is, and that you should get relief immediately, shouldn't you?
Yes. Yeah. Those individuals, once they're done with surgery, there is some discomfort with any sort of surgery just from the actual procedure itself, but the symptoms that bring individuals in for these minimally invasive procedures, they tend to resolve after the surgery. Very gratifying.
That's good. Now, and getting back to the epidural, how frequently can you do that epidural injection?
So it depends upon the effectiveness of the initial epidural. Individuals may have one single injection in which they either get complete relief or they get no relief at all, in which case the reevaluation process determines that there was no effectiveness of it or it was completely effective. If you get partial effect or relief from that, the individuals that perform those types of procedures will oftentimes do a second and even a third procedure in order to see if they can actually increase the amount of relief that the individual has.
Okay. Now there's another disorder that can certainly cause an awful lot of pain and is common in an older age group, and that is the compression fracture. What do you do when someone's vertebrae collapses?
You can treat them non-operatively or conservatively, or there are procedures that can help individuals with this. So initially when we see these individuals, the overriding symptom is pain. And the goal is to try and relieve some of that pain. Initially, pain medication and in certain instances bracing is used and is oftentimes appropriate treatment, and the individuals gain relief from that. Now, there are instances when, regardless of the bracing or the medication, the individuals are in so much discomfort where they cannot get relief, it affects their ability to move, in which case there are procedures, again, minimally invasive, that can help these individuals with their pain management sooner rather than later. Those procedures are termed kyphoplasty and vertebroplasty.
Okay. And could you explain what that means? What are you actually doing?
Sure.
Yes.
When the individual has a compression fracture, oftentimes this vertebral body collapses, but it usually collapses more in the front, so it's a wedge type positioning of the vertebral body. What we do through very, again, minimally invasive procedures is we track down through the back part of the spine, and it allows us a pathway to get into the vertebral body where the vertebral compression fracture is. At that point, vertebroplasty is a procedure where once you have an instrument in the vertebral body, you inject cement and allow that cement to dry, and that stabilizes the fracture. Kyphoplasty takes it a step further where before you put the cement in, you actually put a balloon in there and blow it up. And that helps to restore some of the height. And then once you restore some of that height, you put cement in there and allow it to dry.
Yep. And again, that apparently has relief rather quickly as well.
It's dramatic.
Yeah. Okay. So for you chemists out there, the cement is methyl methacrylate. one of the things that we hear about in spinal stenosis is that people continuously, they're not getting funny, they're not getting relief. And now they're advised to have laminectomies sometimes.
That is true. A lot of it is dependent upon
Right.
the symptoms. Especially with spinal stenosis, individuals oftentimes will find themselves gradually leaning forward, because what that does is it allows to create extra space in an area where the space is narrow. And oftentimes one of the hallmark symptoms is people say, when I go out into the community or I go shopping, I have to lean on a shopping cart in order to get relief. And what that does is it allows more space in there. When you get to that level where you can't get relief other than leaning forward, that's when those diagnostic imaging, the MRI comes into play. And that will tell you exactly how narrow that is. If it is significantly narrow, you can do a procedure called a laminectomy, which is basically removing the back part of the vertebral, of the vertebrae, to allow for more room for those nerves to either come down or to exit.
Yep, and this of course is a more aggressive approach to management.
It is.
Isn't it? And the average person is, what, in a hospital for a while with that?
Well,
Yep.
it depends. It depends on the number of levels, the health of the individual, other medical problems. And so once you perform the procedure, they're obviously monitored in the hospital. And really, when I have people that I perform this procedure on, it actually comes down to 5 basic things. Is their pain under control? Are their vital signs stable, meaning is there, they don't have a fever, their blood pressure's okay? Are they, is their GI tract working okay? That's a big problem with spine surgery, so we make sure of that. Are they safe moving around? And are their blood levels, which we can check with labs, are those okay? Once that criteria is met, they can go.
That's good. Now, there's one last thing we haven't discussed today, and it's more seen in children than in adults, but the scoliosis of the spine, as people get older, sometimes can create issues.
Sure.
What can you, as a spine surgeon, do for those folks?
Well, scoliosis it's a complex issue. Throughout the course of my training, adult scoliosis has gained a lot of momentum. And that can be from a number of reasons. There are individuals, oftentimes when we see it in children, it's idiopathic in nature. That means that we don't know why a child's spine has curved the way it has. And that's the majority of those types of problems. As individuals get older, though, that degenerative process that we talked about at the beginning can lead to curvature in the spine. And ultimately, that can lead to all sorts of symptoms, pain, sciatica, a number of different symptoms. But that is primarily due to the degenerative process, which is different from children. And depending upon the symptoms, ultimately will determine what we do with those individuals.
So I think we have a pretty good synopsis of spine surgery. We thank you very much for this informative session, and I hope that none of you have to go through any of this, but if you do, you know where to go. So thanks for listening, and stay tuned to keep informed.